Thank you very much. Madame Rivasi, s'il vous plaît.
Madame la Présidente.
Thank you, Madam, and thank you, Commissioner, for being with us this afternoon. I wanted to come back to access to vaccines in developing countries because I think you're not entirely clear, and we in Europe are not entirely clear. There are two models. There's the model that you're defending. You're saying we need the laboratories, BioNTech is a case, to equip African countries, as you said, with prefabricated factories. I went to Rwanda. There's prefab containers. They bring in all the process with European staff, and the Africans, all they do is fill the vials. And we talk about African autonomy. No, it's the pharmaceutical labs deciding to manufacture vaccines with their protocol and with the number of vaccines that they want. It's not about developing African autonomy. And then there's another model which the African Union is calling for. They called for it at the EU-Africa summit. They want autonomy. Now, whether it's South Africa and India as well, they asked for the patents to be lifted, and it was the European Commission that blocked that. Who in the European Commission? Did you have a discussion among commissioners, or was it a country such as Germany? Because France doesn't produce vaccines, but who blocked? Which countries blocked it? Why did the Commission not say, OK, we lift IP for vaccines? Now, the WTO said a few days ago they were going to lift IP on vaccines, but only on vaccines, not on treatments, not on medical appliances. They've lots of systems where they cannot export as they wish. So the question I'm asking, and you partly answered, Commissioner, you're in favour of compulsory licenses, OK, but at the WTO we need to lift IP because when there is a pandemic, an emergency, so that those countries can manufacture themselves. And Commissioner, don't tell me that they're not capable of doing it, because in South Africa they have a pharmaceutical industry, they make vaccines, they make medicines, they've got the know-how. So we need to do, as the WTO say, we have a platform and the transfer of know-how, because the know-how is just as important as the patents. And then there needs to be the sufficient number for true autonomy. Then everyone would have access to vaccines, treatments and medical devices. And Europe has not been clear on that. Europe says it's helping Africa, but no, it's helping the pharmaceutical companies to establish themselves in African countries.
Mrs. Yerkovich.